Androgel, testosterone replacement therapy. Androgel is a testosterone replacement therapy used to treat symptoms of low testosterone in men. In this review, we will analyze its indications, dosage, warnings, side effects, and drug interactions. Warning: this video is for educational purposes only. An expert advice of a qualified healthcare professional is always required to diagnose or treat any medical condition. What is Androgel? Testosterone replacement. Androgel is a topical gel that provides exogenous testosterone, replacing the hormone that the body is not able to produce naturally. Form and packaging. It comes in a clear gel in single-use foil sachets or a multi-dose pump. Prescription only. It's only available with a prescription and must be used under doctor's supervision. Indications and usage. Hypogonadism. Androgel is indicated for replacement therapy in men with hypogonadism due to an underlying medical condition or aging. It can improve muscle mass, bone density, and mood. Primary testicular failure. It can be used in adult men who have low or no testosterone due to primary testicular failure. Off-label use. It may be also used off-label in women with hypoactive sexual desire disorder, but its efficacy and safety in this population are not established. Dosage and administration. Dosage forms. Androgel comes in two strengths, 1% and 1.62%. The dose is adjusted based on individual testosterone levels, body weight and age, and it should be taken at the same time each day. Application sites. It's applied to clean, dry, healthy skin on the shoulders or upper arms and avoided contact with the genitals and other people. Users should wait at least 2 hours before swimming or showering. Missed dose. If a dose is missed, it should be skipped, and the next dose should be taken as scheduled. Doubling the dose is not recommended. Storage. Androgel should be stored at room temperature, away from heat and direct sunlight, and out of the reach of children. Warnings and precautions. Pregnancy category X. Androgel can harm a developing fetus, and should not be used in pregnant or breastfeeding women. Prostate and breast cancer. It's contraindicated in men with prostate or breast cancer, and should be used with caution in men with a high risk of developing them. Cardiovascular risk. Androgel may increase the risk of heart attack, stroke, and blood clots, especially in men with underlying cardiovascular disease. Monitoring of blood pressure and lipids is recommended. Warnings and precautions continues. Monitor patients with benign prostatic hyperplasia, BEEF, for worsening of signs and symptoms of BEEF. Avoid unintentional exposure of women or children to Androgel. Secondary exposure to testosterone can produce signs of virilization. Exogenous administration of androgens may lead to azoospermia. Warnings and precautions continues. Edema with or without congestive heart failure, CHF, may be a complication in patients with pre-existing cardiac, renal, or hepatic disease. Sleep apnea may occur in those with risk factors. Monitor serum testosterone, prostate-specific antigen PSA, hemoglobin, hematocrit, liver function tests, and lipid concentrations periodically. Adverse reactions. Adverse events include acne, alopecia, application sites reactions, asthenia, depression, emotional liability, gynecomastia, headache, hypertension, decreased libido, nervousness, breast pain, testis disorder, prostate disorders, prostatic enlargement, prostate cancer, pruritus, hirsutism, and abnormal liver function tests, e.g. transaminases, elevated GGTP, bilirubin. Increases in hematocrit reflective of increases in red blood cell mass, and changes in serum lipid profile may require lowering or discontinuation of testosterone. Androgens, including Androgel, should be used with caution in cancer patients at risk of hypercalcemia. Drug interactions. Prescription medications. Androgel may interact with blood thinners, corticosteroids, insulin, and certain antifungal and antibiotic drugs. Consult with your doctor before taking any new medication. Alcohol and herbal supplements. Alcohol and certain herbal supplements may interact with Androgel, affecting its effectiveness and safety. Additional information. Legal issues. Androgel is involved in a number of lawsuits alleging that it caused heart attacks, strokes, and blood clots in men who used it. The FDA is also investigating its safety. Alternative treatments. There are other methods of testosterone replacement therapy, including injections, patches, pellets, and oral tablets. Each method has its own pros and cons and should be evaluated based on individual needs and preferences. General health maintenance. In addition to hormonal therapy, men with low testosterone should adopt a healthy lifestyle, including regular exercise, a balanced diet, and stress management to optimize their overall health and well-being. Thank you for watching. Please like, share, and subscribe.